How confident are you that your Medicare drug plan still covers what you need? Every year, quietly, the plans change, formularies shift, premiums creep up, pharmacies drop out. Most people never check, and they end up stuck paying for a plan that no longer works. This isn't just about money, it's about getting the medication you depend on. In the next few minutes, I am going to show you exactly what to look at before December 7th so you don't lose coverage. Because what most people don't realize is that your plan can change everything from the drugs it covers to the pharmacy you are allowed to use, without ever sending you more than a letter you might not read. And the price for missing that letter isn't just higher copays. It can mean showing up at the pharmacy counter and discovering the medication you've taken for years suddenly costs full price, not a dime of it covered. This happens every year. Between October 15th and December 7th, something called the Medicare Open Enrollment period opens up. It's your one annual chance to change your Medicare health insurance or prescription drug plan for the following year. But most people treat it like junk mail. They assume nothing changed. They trust that the plan they picked years ago will still work. And that trust is costing them. Nearly 7 out of 10 Medicare beneficiaries didn't compare their coverage options the last time they had the chance. That's 69% of people riding blind. And the insurance companies aren't rushing to correct that. In fact, things are changing faster than ever. For 2026, the number of standalone prescription drug plans dropped by 22%. Over 100 plans simply vanished. If you were on one of them, you had to do something or risk losing coverage entirely. Meanwhile, the plan you stayed on might have quietly moved your expensive brand name drug into a higher tier, turning a $30 copay into a $100 one, with nothing more than a letter you never opened. That letter is called the Annual Notice of Change. And if you didn't read it, you already missed the warning. The forces behind this are massive. The federal government sets new rules every year, pharmaceutical companies negotiate prices, and insurance providers shuffle their formularies to protect their bottom lines. For the first time this year, Medicare directly negotiated lower prices on 10 of the most expensive drugs: insulin, blood thinners, cancer medications. That sounds like good news, and for many it is. But those savings also triggered ripple effects, causing some plans to drop drugs entirely or change which ones they prefer. And if your plan no longer prefers your medication, you pay the price. But here is the most dangerous trick. Even if you do nothing, your plan can disenroll you. This year alone, nearly 3 million Medicare Advantage enrollees were forced off their plans. 3 million people. Some discovered it at the pharmacy, card in hand, told their plan was no longer active. And the group hit hardest were people on zero-premium drug plans that suddenly weren't free anymore. Many had set up automatic premium deductions years ago, but when the premium went from zero to something, the automatic payments stopped, without them ever realizing it. Months later, they lost coverage because those unpaid premiums stacked up in the background, invisible until the system finally cut them off. So your plan didn't just get worse. It quietly walked away, and you might not know until you are standing at the counter needing a life-saving drug. Now let's fix it. You still have time, but you have to look at 3 specific things before December 7th, and the first one is exactly what most people think is perfectly safe: the actual list of drugs your plan covers. It's called the formulary, and insurance companies change it every single year. A medication that was covered in December might be dropped in January, or bumped into a higher tier so your copay jumps from $25 to over $100. The only warning you get is that annual notice of change letter, a dense document that lands in your mailbox sometime in September, easy to mistake for junk. But inside, buried in the fine print, is the list of drugs being removed, restricted, or retiered. And if you don't check, you won't discover the change until you're at the counter, debit card in hand, facing the full retail price. In 2026, the standard Part D deductible rose to $615, and the out-of-pocket cap before catastrophic coverage tops out at $2,100. That sounds like a safety net, but here's what nobody tells you. If your drug falls off the formulary entirely, that $2,000 maximum doesn't apply because the plan isn't covering it at all. You pay everything, every month, forever. A woman in Ohio last year learned this the hard way. She had been taking a brand name blood thinner for 3 years, fully covered under her old plan. She didn't switch. She didn't read the letter. In February, she went to refill, and the pharmacist said, "That'll be $680. Her plan had reclassified it as a non-preferred brand, slashing coverage overnight, and she had to scramble to find an alternative before missing a dose that could have caused a stroke. But that's not the only shock waiting. Some drugs didn't just move to a higher tier, they vanished from the formulary completely. No generic substitute, no therapeutic alternative. Just gone. This happens most often when the government negotiates a lower price on a blockbuster medication. The manufacturer, facing smaller profits, withdraws from certain plan networks or jacks up the cost in a different way. When Medicare announced negotiated lower prices for 10 major drugs this year, insulin, some cancer therapies, blood thinners, the headlines celebrated. But within weeks, multiple Part D plans quietly dropped those same drugs from their list of covered medications. The savings were real for some, but for others, the drug simply disappeared from reach. So the first thing you must do before December 7th is open your plan's website or call the number on your card and ask one direct question. Is every drug I currently take still on your formulary for next year? And at what tier? If the answer is no, or if the tier changed, you have the right to shop for a different plan during open enrollment. Do not wait until January to find out. Now, the second thing to check ties directly into how you pay and where you pick up your prescriptions. Insurance plans don't just change the drugs they cover. They change the pharmacies they work with. You might have used the same drugstore for a decade, but if your plan drops it from the preferred network, your copay can double or triple. And the trick here is subtle. The pharmacy may still be in-network, but no longer preferred. That one-word difference costs you real money. In 2026, with fewer standalone Part D plans available than ever before, insurers are narrowing their preferred pharmacy networks to control costs, and they don't have to send you a personal alert. The information is in the same dense letter you might have ignored. But this is where the trap from earlier springs shut. Remember those tens of thousands of people who lost coverage because they didn't realize their zero premium plans started charging a monthly fee and their automatic deductions stopped? Many of them weren't just paying more for drugs, they lost access to their pharmacy network entirely. When the plan changed from $0 to $20 a month, the automatic Social Security deduction didn't kick in unless they manually re-elected it. And because they never opened the letter, no payment was made. After 3 months of missed premiums, the plan terminated their enrollment. Suddenly, they weren't just out of network, they had no plan at all. So check your premium statement, check your bank deductions, and check the preferred pharmacy list. Because if your payment lapses, none of the other reviews matter. But even if your drugs are on the formulary and your pharmacy is right down the street, there is one last thing that can turn a manageable copay into a financial disaster. It's the part of your plan most people never read until they're standing in a hospital hallway. And it can mean the difference between a few $100s and tens of thousands. That is the third thing, and I am going to show you exactly how to find it. That third thing is your plan's provider network and its prior authorization rules. This isn't about pills. It's about the doctor you trust, the hospital 2 miles from your house, and whether your insurance will actually pay the bill when you need surgery or a specialist. Medicare Advantage plans in particular change their networks every year. Your primary care doctor might be in-network today and out-of-network in January, and nobody is required to send you a personal warning. The information is buried in the plan's online provider directory, and if you don't search it by name, you won't know until you are standing in a hospital hallway holding a bill for tens of thousands of dollars because your plan refused to cover a single night in the ICU. Prior authorization makes this even more dangerous. A plan might decide that starting next year, a certain procedure you've had before needs a new approval. If your doctor submits the request and the insurance company takes 2 weeks to review it, your surgery gets delayed. In some cases, they deny it outright, even after you've already had the operation, because the rules changed retroactively, and they claim you didn't follow the updated protocol. A retired teacher in Pennsylvania found this out after a knee replacement last January. Her plan had dropped the hospital from the preferred network in December. She didn't read the letter. The surgery was scheduled. She showed up, and the hospital was considered out of network. Her out-of-pocket cost jumped from $1,500 to over $38,000. She's now paying monthly installments that will outlast the knee. But here is where it gets truly alarming. It's not just individual plans changing terms. Entire plans are vanishing. I told you the number of standalone prescription drug plans dropped 22% this year, but the same consolidation is hitting Medicare Advantage. A Johns Hopkins study found that nearly 3 million enrollees were forced to disenroll from their Medicare Advantage plans in 2026 because insurers stopped offering those plans in their county. 3 million people got a letter saying their plan no longer exists, and they had to find a new one during open enrollment or default to original Medicare, often without drug coverage. In some states, entire counties now have zero Medicare Advantage options. 106,000 beneficiaries in Alaska have no plan available at all. If you live there and you miss the window, you are out of options for the entire year. And if you think that's bad, consider what happens when you have a gap in drug coverage, even for a few months. Medicare has a late enrollment penalty for Part D that lasts forever. For every month you go without creditable drug coverage after you are eligible, you'll pay an extra 1% of the national base beneficiary premium, which in 2026 is about $39, tacked onto your monthly premium permanently. Go 12 months uncovered. That's 12% extra every month for the rest of your life. Many people don't even realize they've incurred this penalty because it gets silently added years later, long after the enrollment chaos is forgotten. This is the system working as designed. Insurance companies count on your inaction. They profit when you don't switch, when you don't read the fine print, when you assume that what worked this year will work next year. The 69% of people who don't compare plans are not lucky. They're subsidizing everyone else. So now you can see the full picture. 3 pressure points that can turn stable coverage into a financial crisis overnight. Your drug formulary, your pharmacy and premium status, and your provider network all shift behind the scenes. Knowing this is the first step, but you still have to act before December 7th. The next few minutes will give you the exact checklist, step by step, so you can walk into open enrollment knowing precisely what to look for and how to lock in a plan that actually protects you. Here it is. You need to do 3 things before December 7th, and you can finish all of them in under an hour if you have your current plan card and a computer or phone. First, pull up your plan's full drug formulary for next year. Do not just glance at the summary. Search your exact medications, name, dosage, and frequency, one by one. If any drug has moved to a higher tier or shows a new prior authorization or step therapy requirement, that will change your monthly cost and delay your fill. For 2026. Remember that the deductible may now be $615, and the out-of-pocket max is $2,100. If your drug is covered but at a higher tier, you can use the Medicare Plan Finder tool at medicare.gov to compare every other Part D or Advantage plan in your zip code. Enter your drugs once, and the tool sorts plans by total annual cost, including premiums, deductibles, and copays. Thousands of people save hundreds of dollars just by switching to a plan that ranks those same drugs as preferred generics instead of non-preferred brands. The difference can be $90 a month versus $9 a month for the exact same prescription. Second, confirm that your pharmacy is still preferred. Log into your plan portal, or call the number on the back of your card and ask directly. Is this specific location a preferred in-network pharmacy for next year? If they say no or standard, your copays will rise. If the plan changed its premium, even from $0 to $20, double-check that your automatic payment is still active. Do not assume. Thousands of beneficiaries lost coverage this year because their zero premium plans started charging and their Social Security deduction never resumed. If you see a missed premium, call 1-800-MEDICARE immediately to prevent disenrollment. If you're on a Medicare Advantage plan, also check that your primary care doctor, your preferred hospital, and any specialists you see regularly are still in-network. Search by name on the plan's provider directory. Don't rely on a general statement that the plan works in your area. A hospital can be in your city and still be out of network. Third, actually compare. The Medicare Plan Finder lets you run side-by-side comparisons of up to 3 plans. Look not just at the lowest premium, but at the total estimated yearly cost, including what you'll pay for your specific drugs. A plan with a $40 premium might save you $2,000 on prescriptions, compared to a plan with a 0 premium. And if you find a better plan, enrolling is immediate. Click through the online form or call the number, and the new coverage takes effect January 1st. You do not need to cancel your old plan. It automatically ends when the new one begins. Now here's the final surprising detail most guides won't tell you. Even after December 7th, if you move to a new address, lose employer coverage, or if Medicare gives you a special enrollment period for any reason, you are allowed to switch your drug or Advantage plan outside the standard window. But you have to act fast, usually within 60 days of the qualifying event. So mark your calendar, not just for open enrollment, but for any life change that might unlock that door. And if you ever get a bill that seems wrong, do not pay it without calling your plan. Many charges get reversed once you confirm you followed the rules. Protect yourself by knowing those rules, and I'll show you exactly where to get free, live, one-on-one help right now. Free. One-on-one help is available through your State Health Insurance Assistance Program, also called SHIP. These are trained counselors, not salespeople, and they will walk you through your options at no cost. You can find their number at shiptocenter.org or call 1-800-MEDICARE. Use the tools, make the calls, and do the 3 checks we covered: your drug formulary, your pharmacy, and premium status, and your provider network. The system is not built to protect the person who stays passive. The 69% who don't look are the ones who end up paying for everyone else. But you don't have to be one of them. If this made sense to you, make sure to hit like and subscribe so you don't miss the next deep dive. And if you want to go even further, I've put a special offer in the first pinned comment below. Something just for viewers who are serious about taking control. Don't let your plan choose for you. You've got until December 7th. Use it well.